Exploring the emotional behaviors affected by Duchenne muscular dystrophy. Duchenne muscular dystrophy is a neuromuscular disease that affects 1 in 5,000 boys worldwide. It is also known as DMD, and throughout this video we'll be referring to Duchenne muscular dystrophy as DMD. DMD patients generally exhibit progressive muscle degeneration and weakness, which leads to loss of ambulation and premature death from cardiomyopathy failure. DMD is known to be caused by mutations in the dystrophin gene, and this dystrophin gene is part of the dystrophin glycoprotein complex. This complex acts as a scaffold between the actin cytoskeleton and laminin in the ECM of muscle cells. This is known to stabilize the sarcolemma of the skeletal muscle. The dystrophin gene seen here in yellow is a 427 kilodalton protein. Mutations observed in the dystrophin gene can be found at various locations, and these lead to a loss of structural continuity between the extracellular matrix and the contractile machinery in the skeletal muscle fibers. This is what is believed to contribute to the progressive loss of muscles, which then leads to loss of ambulation in DMD patients. In this video, we will be investigating the effects mutations in the dystrophin gene may have on emotional behaviors and development of DMD patients. In a 2015 study by Zaki and colleagues, the characteristics of DMD neuropsychiatric profile were explored in the context of genotypic and phenotypic characteristics. In this study, 87 DMD males completed a comprehensive neuropsychiatric assessment where they observed intellectual disability in 26% of the DMD patients, autistic spectrum disorder in 21% of the patients, hyperactivity in 24% of the patients, and clinical levels of internalizing and externalizing problems in 24% and 15% respectively. While the role of dystrophin isoforms in the brain are not fully known, researchers acknowledge that the brain is affected by the lack of dystrophin and mutations which disrupt brain isoforms DP140 and DP71. These isoforms are associated with lower IQ. From this study, researchers were able to conclude that DMD males are at a high risk for neuropsychiatric disturbance, and this seems to increase with specific mutations on the dystrophin gene. They found that mutations in the prime end of the dystrophin gene affect isoforms DP427, DP427C, and DP427P, which are respectively expressed in skeletal and cardiac muscles, in the neurons of the cortex, and in the cerebellar Purkinje cells. According to another study by Riccati and colleagues, the 3 disorders which are prevalent in DMD males are autistic spectrum disorder, attention deficit hyperactivity disorder, also known as ADHD, and obsessive compulsive disorder, also known as OCD.
In addition to that, Zaki and colleagues found a high prevalence of emotional and behavioral problems in the 87 males with DMD. About 25% of the participants had scores in the clinical range for internalizing problems which manifested as anxiety, depression, and obsessive-compulsive disorder behavior. Furthermore, 1 in 6 scored in the clinical range for externalizing behavioral problems. And while these internalizing and externalizing problems are not directly related to a specific genotype, they observed that these were more common in males with a mutation at the 3' end of the dystrophin gene. Due to the high prevalence of combinations of neuropsychiatric symptoms, where more than a third of the males had at least 2 disorders, Zaki and colleagues believe that this clustering of symptoms suggests presence of DMD neuropsychiatric syndrome. It is evident that DMD patients, along with experiencing physical challenges due to progressive muscular degeneration, also encounter various neuropsychiatric disorders throughout their lifetime. These can extend from internalized behavioral problems such as anxiety, depression, and OCD to prevalence of autistic spectrum disorder and ADHD. Treatment and therapy for DMD patients needs to incorporate treatment and care targeting improvement of neuropsychological disorders as well. Even though there continues to be gaps in knowledge in regards to the effect of DMD on neuropsychiatric disorders, the therapies used to restore dystrophin to delay disease progression can potentially be used to improve the neurodevelopment syndrome, as well as researchers have acknowledged that mutations in dystrophin gene are related to some of these disorders.